Welcome to this webinar on first line advice for irritable bowel syndrome. My name is Marianne Williams and I'm a specialist IBS and allergy dietitian. I want to look at the first line dietary advice for IBS because often this is all that is needed to help people with their IBS symptoms, and they don't actually need to do complex diets like the low FODMAP diet. So I think it's really important to rule out these simple aspects before you move on to anything else. But one of the areas that I want to just cover today quickly is that some patients may actually have other symptoms known as red flags. And it's really important that you're aware of these so that you can go and get seen by your GP as soon as possible. So those red flags would be things like, have you got blood in your stools? Have you had unexplained significant weight loss? So you haven't been trying to lose weight, or you haven't been on a restricted diet. There's no reason why you've lost weight. Unexplained low iron levels, so there's no explanation for why your iron level is low. A sudden change in symptoms, so for instance, you've always been slightly constipated and suddenly in the last few months you've got diarrhea a lot. That's a sudden change and needs investigation. Waking at night regularly with your gut symptoms, that's not normal with IBS, and if you're getting that, then it's really important to see your GP. It's different from waking up to go to the loo and then getting gut symptoms. What we're talking about is gut symptoms that actually wake you up. The other area to cover is the tests that should be done for patients with IBS. If you've had symptoms of IBS for longer than 6 months, then you should have these tests on the screen. And the really important one as well is the celiac test at the bottom of the list there. That's because celiac disease, it's an autoimmune disease, but it has symptoms in the gut that are very similar to IBS. So it needs to be ruled out and just check that you haven't actually got celiac disease. So let's look at the symptoms of IBS. You can have a myriad of symptoms, but generally the main ones are urgency, so racing to the loo, wind, bloating, abdominal pain, nausea, acid reflux, and gurgling. Now, you don't necessarily have to have all of those, but the chances are you've got a few of them. And some patients can be more constipated, some patients can have a more diarrhea-dominant IBS, and some patients may be a mixture of having diarrhea and constipation. So it varies between person to person, but the most common symptoms are those on the screen. So what are the root causes for IBS? Why do people end up with IBS? Well, there are lots of different causes. So things like gastroenteritis, if you've had norovirus or some very nasty gut infection, or food poisoning, for instance, those can both lead to changes in the gut, which might end up causing irritable bowel syndrome in the long run. Poor diet and lifestyle. So we're going to cover that here in this first line advice webinar. Lactose intolerance, diet high in fermentable foods, stress and anxiety, or changes to the gut bacteria for a myriad of reasons. All of these can be causes of IBS. So what should you do first? Well, let's look at the simple things like alcohol. So alcohol, we know from research, can cause or worsen IBS symptoms. This is particularly the case in women, and it can cause loose stools, abdominal pain, nausea, indigestion, diarrhea. So the first thing to look at is your alcohol intake. Are you within guidelines for an alcohol intake? Do you feel that your alcohol intake is linked to your symptoms? The second aspect is caffeine. There is some evidence suggesting that caffeine may cause or worsen IBS symptoms. So have a look at how much caffeine you're having and perhaps look at reducing it and seeing if a reduction can help reduce your IBS symptoms. Spicy food. Evidence suggests that spicy food may cause symptoms, particularly in men. It may cause abdominal pain, loose stools, and reflux. So again, look at your spicy food intake and see whether you can reduce this and tally it with whether your symptoms then reduce as well. Fatty food, there's some evidence that high fat foods can cause abdominal pain, nausea, heartburn, and burping. So again, really important to look at those. So if we assess the intake of alcohol, caffeine, spicy food, and fatty food, then I think you really are looking at some of the really basic areas that might be enough to make a difference. So alcohol, maximum 14 units a week and spread drinking over 3 or more days. Caffeine, avoid consuming more than 400 milligrams of caffeine. That's about 4 cups of brewed coffee, 10 cans of cola, or 2 energy shot drinks. So avoid more per day than that. Avoid taking more than that per day. Spicy food. Evidence suggests that spicy food may cause symptoms, particularly in men, and fatty food, reducing your fat intake, may relieve some IBS symptoms that occur after eating. So those are the first things to look at. Then we look at lifestyle. Lifestyle changes have been shown to really help with IBS. So that's sitting down and having 3 proper meals a day and sitting down to eat. So not eating on the run, not eating your breakfast cereal out of a bowl as you're racing out of the door. Always sitting down, breakfast, lunch, and dinner, and just taking time. Don't eat on the run, eat slowly, enjoy your food, and have a digital free zone while you're eating. So don't look at your phone or your iPad or your computer while you're eating. Allow your body to relax and digest completely so that it really gets a chance, because you're going to affect your digestion and affect your IBS if you're eating on the run and not relaxing. So elimination, a lot of patients gravitate towards eliminating food groups. And the question is, should they be doing that? Should they be eliminating food groups in their diet? So what are the most popular diets that patients tend to use? Well, the first one is the gluten-free diet, and I want to look at that in a little bit more detail here. So gluten is found in wheat, barley, and rye. But the problems with wheat, there are a number of conditions, but most are not linked to IBS, and each condition requires a completely different dietary intervention. So it's important that you get the correct diagnosis. Now, the first wheat associated disease is celiac disease, which you've already touched on earlier. And this is caused by the gluten protein, and it's an autoimmune condition, as I mentioned. It affects about 1% of the population. Now, that is nothing to do with IBS. Wheat allergy, that again involves the gluten protein, and it's an immune system reaction to the protein. So people that get baker's asthma, so you've got people who bake a lot and are involved a lot of flour in the air, they can end up with asthma symptoms, and that is an allergic reaction to the gluten protein. And then we've got fructan sensitivity. Now, this is fermentation in the gut, and this is to do with the FODMAPs, the fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. That's a horrible long mouthful. So just think of it as a carbohydrate, not all carbohydrates, but a particular carbohydrates. And the particular carbohydrate we're looking at are called fructans, and they ferment in the gut, causing IBS symptoms. So if we look at the grain, the wheat grain, we can see the wheat grain has gluten in it, which is a protein, and you can see the red arrow there. It's also got fructans, which are a FODMAP. So two completely different things in a wheat grain. So the learning point from this is that it's the fructans in wheat, barley, and rye that can cause IBS symptoms. Gluten does not cause IBS. It causes conditions like celiac disease and wheat allergy. It does not cause IBS. It's the fructans in the wheat that cause IBS. So what you could do is you could try a 2-week low wheat diet and see if it helps. You could try reducing wheat, not a totally wheat-free diet, but just try reducing it. So you could cut back on bread, pasta, cakes, biscuits, and wheat-based cereals, but do replace them with alternatives. So rice, potato, oats, quinoa, buckwheat, polenta, all of those are fine. So the main staples that people tend to replace things with are rice, potatoes, and oats. You can use gluten-free foods because these are free from fructans, because they don't contain any wheat, barley, and rye. So you could use a gluten-free food in the supermarket because you'd be in essence piggybacking on the back of that, because it has no wheat, barley, and rye in. So useful for your low wheat diet. But really important is that if you see no improvement in your symptoms after the 2 weeks, then you must stop the diet and put wheat back in, because it means it's not the cause. I so often see patients that have taken something out, it's made no difference, but they've been too scared to put it back in again. That's really important. What you've done is a test. You've tested, it didn't work, so you put it back in again. Okay, the second diet that's really popular is the dairy-free diet. Should you use a dairy-free diet for your IBS? Well, again, a bit like with wheat, dairy contains both dairy proteins and dairy sugars, and both can cause gut symptoms, but both require different dietary interventions, and therefore it's important to get the correct diagnosis. So you get lactose intolerance or you get dairy allergy. Now, lactose intolerance is where you're simply lacking an enzyme called lactase, which breaks down the lactose in your dairy foods. It requires a low lactose diet, not a dairy-free diet. It's a completely different thing. The immune reactions are the ones linked to dairy allergy, where your immune system is reacting to the casein and the whey, not the lactose, the casein and the whey. Lactose is a sugar, casein and whey is a protein. Allergies are always involved with proteins. And this requires a totally dairy-free diet, free from any mammalian dairy. Now, that is completely different to what you want to do with IBS. With IBS, the only likely issue with dairy is lactose intolerance. And you simply need a low lactose diet where you take out the main lactose products, which are milk, ice cream, yogurt, for instance. You can still eat cheese, you can still eat cream, you can still have butter. All of those things can stay in your diet. So the really important thing with IBS is that you're just lowering the high lactose dairy products. You are not taking dairy out of your diet. So it is a lactose-free diet or low lactose diet, not a dairy-free diet. So the learning point here is that the lactose in dairy can cause IBS symptoms. Dairy allergy does not cause IBS. It may cause symptoms that seem very similar, but it is not causing IBS. So you could try a 2-week low lactose diet. If you've already done the 2-week low wheat diet, you could do a 2-week low lactose diet where you just take 2 weeks to simply lower the lactose in your diet. It's not a totally dairy-free diet. You simply swap out your normal milk and yogurt for your low lactose alternatives. You can eat normal cheese, butter, cream, and chocolate. If there's no improvement, then stop the diet and put the dairy back into your diet because it hasn't been the result that you wanted and it's therefore not the cause. So put the dairy back in your diet, put the lactose back in your diet if it's made no difference. So one of the areas that we get asked about a lot are probiotics. And the national guidelines say take a probiotic for 12 weeks, but stop if no improvement is noted. The positive effects of probiotics tend to wear off about 1 to 3 weeks after you stop the probiotics. So it may mean you need to stay on the probiotics forever, which is an expensive consideration. It may help if you've suffered with gastroenteritis or you've taken antibiotics. It may help to have a probiotic. And it may help if you've suffered with diarrhea following a recent course of antibiotics. But bear in mind, it can be expensive because the effects do wear off once you stop them. So should you get allergy testing? This is a big question we get from patients is, oh, I want to get allergy testing because that'll sort out or give me the causes for my IBS. So allergy involves the immune system, whereas IBS involves the plumbing of your guts. It is absolutely nothing to do with the immune system. So IBS does not involve the immune system. It is not an allergy. And therefore, IBS, you will have no benefit from getting allergy tests at all. It won't tell you anything, and it may actually lead you down a blind alley. So definitely do not get allergy testing. It will not help you in finding the cause for your IBS symptoms. So in summary, what can you do to help your IBS as a first line approach? You can look at your intake of alcohol, caffeine, spicy food, fatty food, and lifestyle changes. You could try a 2-week low wheat diet. You could try a 2-week low lactose diet. And you could try probiotics for 2 months. Don't forget what we looked at earlier. If you have any of these red flags, please go and see your GP. So blood in your stools, unexplained significant weight loss, unexplained low iron levels, sudden change in symptoms, and waking at night regularly with your gut symptoms. With those first line IBS suggestions I've made, try them for 3 to 4 months. And if you're no better, then move on to the second line advice by using the low FODMAP diet. And you can